The study I described in the abstract was conducted a couple of years ago as part of my PhD, and we used blood-based spectroscopy to detect individuals with Alzheimer's using blood plasma samples. So there have been quite a few advancements in the field of brain imaging as well as CSF testing. However, these come with some disadvantages, such as the high cost of the tests, as well as the invasive nature of sampling. So these kind of disadvantages limit their use as a first-line diagnostic tool. And for this reason, we tried to use blood as an alternative sample. And there have been many research groups that are studying blood as for diagnosis of Alzheimer's. So we use infrared spectroscopy specifically. And just to give you a bit of an overview of how spectroscopy works. So infrared spectroscopy studies the interaction between light and biological matter, and it kind of causes characteristic chemical motions of the biomolecules that are within a sample. And these motions generate characteristic spectra known as biological fingerprints. And these fingerprints will differ between people who have the disease from those who don't. And then these differences could be easily used as a diagnostic tool. So in the specific study, we used blood samples, and we were able to show that we can discriminate Alzheimer's patients from those who were healthy with quite high diagnostic accuracy. And what is also important is that we, in a smaller cohort, we included with patients that had a different dementia with Lewy bodies. We were able to differentiate those from those who had Alzheimer's disease. And this is very important and might clinically very challenging. So if we could offer that using a blood test, that would be great. And not only for diagnosis, but it could also be used probably for an accurate prognosis and to use the right patient for the right medication or clinical trial.